House of Motion number 10, Mr. Delaney.
Recognize the member from Mississauga-Streetsville.
Thank you very much, Speaker. Speaker, I move that in the opinion of this House, water fluoridation promotes good health, and the optimal concentration of fluoride in drinking water is essential to the health of Ontarians by minimizing tooth decay and helping restore tooth enamel. Thank you, Speaker. Speaker, this past summer, I met with a number of dentists from our Halton Peel Dental Association to resolve some issues between the province and the dental profession. And at one of the meetings, almost in passing, one of my guests mentioned municipal water fluoridation and expressed a worry that municipalities might move away from it. That discussion caused me to get interested in the remark. In the most recent municipal election, I was surprised by the number of fringe candidates advocating something as egregiously stupid as ceasing to add fluoride to municipal drinking water. So I looked into municipal water fluoridation some more, and I found some of the most transparent junk science that I've seen in quite a while. We need to shine a light on something that Ontario is generally doing very well, adding a small amount of the element fluorine, about 1 milligram per litre, to municipal drinking water to protect against tooth decay, and not only raise the profile of doing something right, but to sound a warning against doing something wrong by changing this sound and healthy practice. To this end, I'm very pleased to welcome some of the best dentists in the Halton Peel area who've taken some of their very valuable time to be with us today. I call members' attention to the East Gallery, where I'd like to welcome Dr. Lisa Bentley, past president of the Halton Peel Dental Association and current chair of the ODA Economics Committee, Mr. Frank Bevilacqua, ODA's Director of Professional Government and Component Society Affairs, Dr. Rafi Chulgin, member of the ODA Board of Directors, Dr. Steve Lipinski, past president of the HPDA and my own dentist, Ms. Roberta McLean, ODA's Health Policy Specialist, Dr. Brian Tenishuk, immediately past president of the HPDA and a current member of the ODA Education Committee, Dr. Larry Tenishuk, member of the ODA Board of Directors, and his wife, Mrs. Olga Tenishuk, whose birthday is today, Dr. Brenda Thompson, past president of the HPDA and a current member of the ODA's Membership Services Committee. So let's start at the beginning. Fluorine is a natural element. In its pure form, it's a gas. It's found in nature combined in minerals in rocks and soil. When water passes over these rocks and soil, it dissolves fluoride compounds and releases fluoride ions into the water. Fluoride is naturally found in varying concentrations in water everywhere. Where fluoride concentration is about 0.8 to 1/1000th of 1 gram per litre of water, or 0.8 to 1 milligrams per litre, drinking such water regularly makes the outer layer of teeth stronger and much less likely to get cavities. In Ontario, the water found in Stratford naturally has just about this concentration of fluoride. As researchers half a century ago mapped the incidence of tooth decay and overlaid it with naturally occurring areas of fluoride concentrations, the picture was crystal clear. Where fluoride was about 0.8 milligrams per litre, children and adults had cavities and tooth decay at rates consistently much lower than in areas where the concentration of fluoride was lower than this 0.8 milligrams per litre threshold. Not surprisingly, when fluoride was added to municipal drinking water with low fluoride content, tooth decay rates dropped as people regularly ingested the local drinking water. Now, after the common cold, tooth decay is the most frequent disease in the world and one of the leading causes of absences from school. If you take the flu shot to avoid an influenza infection, if you take a vaccination to avoid a whole host of fatal or debilitating diseases such as polio, tuberculosis, and others, why wouldn't you want drinking water that strengthens your teeth and protects them from decay? We pasteurize our milk to protect ourselves from dangerous bacteria such as Salmonella, E. coli, and Listeria. We add small trace amounts of chlorine to our drinking water to kill similar bacteria in our water. In my parents' day, their water was not fluoridated, and they and most of their friends routinely lost all of their teeth and wore both upper and lower plates early in adulthood. I did benefit from municipal drinking water all my life in 3 provinces, and combined with regular dental care, I still have my own teeth, which also means I'm a goaltender. In 2012, Ontario's Chief Medical Officer of Health, goalies wear helmets these days. In 2012, Ontario's Chief Medical Officer of Health, Arlene King, published a report on oral health. It made 4 recommendations for action by the province. Let me read recommendation number 1 verbatim. Conduct a review of current policies and mechanisms to ensure that all Ontarians have access to optimally fluoridated drinking water. The fact is that tooth decay and gum disease are not only preventable, they're easy to prevent. Fluoridation works just by having a drink of water, and it reaches everybody served by a fluoridated supply of municipal drinking water. You don't need private dental insurance to get access to it. Most municipalities in Ontario bring the levels of naturally occurring fluoride in their water up to this optimal level of 0.8 to 1 milligrams per liter by adding the difference at the filtration plant where their water is treated. Another way to see the cause and effect between tooth decay and the fluoridation of water is to look at data where city councils have listened to the junk science and stopped fluoridating their water. One such area is Dorval, Quebec, near where I grew up on the island of Montreal. Water fluoridation was halted in Dorval, Quebec in 2003, and within 3 years, the rates of tooth decay had doubled. In Ontario, the city of Windsor stopped fluoridating its water in 2013. Now, last weekend, a group of our Halt and Peel dentists came to my home to visit me to help me prepare for today. They were joined by a dentist named Dr. Charles Frank, a plain-spoken Windsor area practitioner. Here is what Dr. Frank said to me of his professional work in Windsor, and I will read it verbatim. In the Windsor-Essex region, there is a diagonal line that runs through the county that separated the fluoridated and non-fluoridated areas. It was common for the dentists to be able to have a good idea of which side of the line the children came from based upon the amount and the severity of the dental decay that they were presented with. It can take a few years before the effects of the removal of fluoride from the water supply become noticeable. It hasn't been very long, and already I've noticed an increase in the level of dental decay. A couple of months ago, I treated 3 children from Windsor, all between the ages of 4 and 5 years of age, who, due to their young age and the quantity of dental treatment needed, required this treatment in hospital as outpatients under general anesthesia. A child of this age normally has 20 teeth. The first child had 9 teeth that needed to be treated, the next 13, and the last 8. This is far in excess of what I am used to seeing in Windsor for children of this age. As a healthcare professional, it has been disheartening to see this needless increase in preventable dental disease in these children, one of the more vulnerable segments of our population. As an aside, each of these children are on the social services program administered by the city, another vulnerable segment of our community. This past week, Carol Pavlov, who administers the city's dental program, called our office and has advised us that the program is running out of funds due to the increased demand for dental treatment. It seems, Speaker, that the $150,000 that the Windsor City Council thought it might save has been spent many times over in treating completely foreseeable and preventable dental decay. I've read through the so-called arguments against water fluoridation. They span the spectrum from silly through pseudoscience all the way to the paranoid. I especially enjoyed reading the one about fluorine being a mind control agent used by dictators. The real science is methodical, clear, consistent, and conclusive. Fluoride in the right concentrations, coupled with regular dental care, means stronger tooth enamel and less tooth decay and gum disease. In my opinion, it's time for our Ministry of Health to step up and implement Dr. King's recommendation and insist that all Ontario municipal drinking water be treated not just with chlorine to kill bacteria, but fluorine to prevent tooth decay, just as all milk must be pasteurized and all children vaccinated against preventable diseases. Moreover, it's time for our healthcare professionals, especially our dentists, doctors, hospitals, CCACs, and public health clinics, not to take the good sense and sound science of fluoridation for granted. They need to use their access to their patients to treat them and their families and to teach them why their water is treated with fluoride and why it is important that it remains so. I just want to thank all of our wonderful dentists for their overwhelming support, not just those who are here, but those all across Ontario, and for speaking up on behalf of their patients and urging our province and our cities to act, and in most cases to continue to act, responsibly by fluoridating Ontario's drinking water now and into the future. Thank you very much, Speaker.